Thank you, Harold. You're like the best uncle at these gatherings. It is like having a family member, isn't it? Here to welcome us. What a wonderful feeling in this house. I hope that you all see how bright our future is and how actually wonderful it is to accept the responsibility for the care of our loved ones. Your program says that we're actually going to be a team of doctors, but I'm going to start things off with a few short words, and then I'd like to play a game with you before we hear from the other Aboriginal doctors who are working on all our behalf. So just a couple of ideas before we start the really fun part of our morning. That we, the First Nations of BC, are uniquely positioned to take on a greater role, the lead role, and believe me, a lead role is really great, much better than a supporting role, in the design and delivery of First Nations health services. And under a new First Nations Health Authority, policy development, program management, and service delivery will take place closer to home, within a framework that respects our wisdom, our teachings, and our ways of being and knowing. We can also call it local decision-making. In an era of skyrocketing healthcare costs, a lot of evidence suggests that an increased focus on health promotion and disease prevention is the only way to keep our health system sustainable. And we understand that as Aboriginal people, almost to a person, that we must take care of everything at once, not just one small section or only a few people. BC First Nations have an unprecedented ability to transform the provincial health system for the benefit of all. And since the beginning of this wonderful health reform process, BC First Nations have always expressed a need for a blended healthcare model, one that is not just medical, but is also based in traditional medicines, ceremony, philosophy, and protocol. Our model, our collective model, must be holistic and aim to keep people well, not just deal with illness. And we, the First Nations, have a unique opportunity to create and test new approaches to healthcare and to transform our system into a wellness system. The Interim First Nations Health Authority recognizes that it has a number of existing partners and potential partners who also have a vested interest in promoting disease prevention through a health and wellness approach. The Interim First Nations Health Authority cannot do this work alone. Our organization knows that it needs to work collaboratively with partners and take on a leadership role in promoting wellness for all. And many of these partners also acknowledge that it is difficult for agencies such as health authorities to lead this area when the majority of their responsibility is focused on maintaining an efficient acute care system, something which is still needed regardless of the amount of illness prevention that is done. These are necessary services and those which many First Nations access now or will access in the future. But the Interim First Nations Health Authority, or the First Nations Health Authority of the future, will have the ability to invest all of its resources into wellness, disease prevention, enhanced primary care, and holding traditional health and traditional health wisdom close to our hearts. It makes sense that the First Nations Health Authority leads this work on behalf of everyone in BC, as we are best positioned to do so, and we have a clear mandate to do exactly that. So, this morning I have the very joyful experience of asking a very simple question. Well, it's simple to ask, but it has lots of right answers. What can we do to improve our health? What can we do to improve our health? Evidence shows that many First Nations are adversely affected by chronic diseases, in particular cancers, diabetes, respiratory illness, heart disease, depression, and other mental illnesses. We know, as healthcare practitioners, that there are 5 key areas that contribute hugely to addressing wellness and preventing disease. And they're on your table. If you could clear away your little cups and your dead granola bars. Number 1, maintaining a healthy weight. Number 2, being active. Number 3, respecting tobacco. Number 4, eating healthy. And number 5, last but not least, nurturing the spirit. If we do nothing but these 5 things, we would be a very different population within a single generation than we are now. And we can do this. I know we can. And we're sure that many of you are already doing some or all of these things well for yourselves and for your families. And this morning, we just want to talk about them and share some of those ideas with each other, but not just share ideas and knowledge, but share your heartfelt conviction about the actions that you take to protect the health of your loved ones. I now have the pleasure of introducing a very auspicious team of experts who will tell us more about the Interim First Nations Health Authority's health and wellness approach. The Interim First Nations Health Authority has a vision: healthy children, families, and communities. The Interim First Nations Health Authority knows it needs an approach that is centered on a shared understanding of the holistic vision of wellness shared by BC's First Nations. Many people have helped to develop this draft model, so this team will present the model and approach to you that has evolved from what you have told us over the last many gathering wisdom and our meetings with individual First Nations and hubs. And we will also be asking for your feedback on this presented model and whether the Interim First Nations Health Authority has captured your words, vision, thoughts, and concepts of wellness appropriately. So if our panel could come up, I'd like to introduce our first speaker, Dr. Georgia Kaiba.
Hello. I welcome you here today, and I look forward to the knowledge shared over the next few days. Let me introduce myself. My name is Dr. Georgia Kaiba, and I'm Northern Shoshone from the Selkirk First Nation in the Yukon. I'm a naturopathic physician, and I've been working for the Intern First Nation Health Authority for a number of years on traditional wellness initiatives. Although I grew up in Vancouver, I spent my summers as a child and young adult in the Yukon. This allowed me to connect with my large family up there and connect to the land. I was lucky to grow up with many traditional family members, and I had a close aunt who was a traditional healer. All of this shaped me into wanting to become a naturopathic physician and learn a holistic model of health. I'm so excited and honored to be here today to present to you on this holistic model. This is passionate to me more so than ever, as I have a young daughter and I want her future to be healthy on all levels. This model is derived from the medicine wheel and comes from holistic perspectives. The basis of this model is to achieve health and wellness by taking a look at all areas of this model. In the center, you'll see that it says that it represents the individual. It is the individual who needs to take responsibility for their own health and wellness. As a naturopathic physician, it is my job to be a catalyst for healing, but it is the individual who ultimately heals themselves. For a healthy family, community, and nation, it starts with you, the individual. It is all the relationships an individual has with their environment that affects their own health, as well as the health of their family, community, workplace, and the population at large. The next ring of the diagram represents the 4 aspects of being: physical, emotional, spiritual, and mental well-being. All 4 need to be in balance to achieve wellness. It's important to nurture all 4 aspects of your being to achieve this balance. It's very common to focus on 1 or 2 areas and to look over the other areas. This may create some improvement, but for true health and healing, you need to address all 4 areas. So for example, most of you have an idea of how to address your physical well-being, whether it is to address your physical activity, your nutrition, or your weight. When looking at your mental well-being, you may consider looking at your career satisfaction and how you manage your stress. When looking at your emotional well-being, it's important to nurture your relationships and identify your support network. When looking at your spiritual well-being, it's important to nurture your spirit, whether it's through spirituality, religion, or being creative, such as drumming, singing, dancing, and writing. All 4 aspects create wellness. However, these 4 areas do not stand alone. They are influenced by the other rings of the diagram that are to follow. All aspects of the diagram are interconnected and related to each other, and they need balance to achieve wellness. So I look forward to hearing your feedback on this diagram, and I look forward to hearing the next presenters. Thank you.
Thank you, Dr. Kaiba. Dr. Shannon Waters and Dr. Naomi Dove.
So thank you, Evan, and it's good to be here today and good to see all of you. As Evan was saying, I'm Dr. Shannon Waters, and I have one of my workmates, Dr. Naomi Dove, and we have a third physician with First Nations Inuit Health BC region, who Evan had mentioned earlier, Dr. Isaac Sobel, here today as well. I am a Coast Salish person from Stamatis First Nation on Vancouver Island, and I'm really happy here to talk to you today about the second ring in the wellness model that the First Nations Health Authority is presenting today, and that's the ring looking at wellness values. And these values, I think, are something that we all like to keep every day in our mind while we're in our workplace. Wisdom, respect, relationships, and responsibility. I think that's something that all our frontline workers working in communities keep in their mind every day, and especially when I'm in the realm of government, which is very different when I was working as a family doctor in my home community before. These values are especially important to remember in my daily work as well. Respect is about honoring where you came from, your culture, your traditions, yourself. It is intergenerational and is passed on through one's community and family. It is the driving force of the community because it impacts all of our life experiences, including our relationships, our health, and our work. Wisdom includes knowledge of language, traditions, culture, and medicine. Like respect, wisdom is an understanding that is passed on by our ancestors from generation to generation and has existed since time immemorial. Responsibility. Every person has a responsibility to self, to their families, to communities, and to the land. Responsibility extends not just to those that we come into contact with or relate to, but also to the roles we play within our families, our work, and our experiences in the world. And finally, relationships. Relationships are what sustains us. Relationships and responsibility go hand in hand. Like responsibility, relationships involve mutual accountability and reciprocity. Relationships are about togetherness, team building, capacity building, nurturing, sharing, strength, and love.
Thank you. Thanks, Shannon. Thanks, Naomi. And now Dr. Sarah Williams.
Hello, everyone. In my traditional language, we say Bojo, and so Bojo, Azawa Gijikakwa Indigenous Muskin Dodem. My name is Dr. Sarah Williams, and I'm from Curve Lake First Nations in Ontario. This is the homeland of my father, and this is where I was born and raised. I also would like to acknowledge the people of my mother. They are also Anishinaabe, and they are from the Trout Lake area in northwestern Ontario. I'm very, very happy to be here today as a First Nations physician, as I'm working with the First Nations Interim Health Authority, and this is an extremely amazing time for our people. As we witnessed last night in the signing of the partnership accord with VHA and the Vancouver Island peoples, we we are at a pivotal moment in healthcare. I am greatly honored and privileged to be talking about the component of the circle that deals with land, community, family, and nations. And in this respect, I'd like to acknowledge the land that we are on and those people who have taken care of this land for time immemorial. In my language, we call this circle Bimatazewen, and what that means is walking the good road and walking a good path. And when we talk about walking a good path and a good road, we walk that path not on Mother Earth, but we walk that path with Mother Earth, and we walk that path with our communities, our families, and our nations. In medicine, we talk about primary health care. And when I was thinking about what that really means, primary means the beginning. And this model represents the beginning. It represents the philosophy of our nations and our people. So to me, this model is actually primary health care. It is living and walking this path that allowed our people to survive and to live, basically to live for time immemorial. And it's living in this way that I believe will enable us to survive and be well into the future. Thank you.
Thank you. And our fourth and final doctor is Dr. David McClane.
I'm with the BC Cancer Agency. I'm the head of the prevention programs. It's wonderful to be here with leaders who are the future. What we're seeing here in my ring is social, cultural, economic, and environmental. This ring, plus the others, is the key to wellness. Wellness, a centeredness, is very important to good health and the prevention of disease. Why is somebody from the Cancer Agency here speaking to you? Well, because 50% of cancers, at least, can be prevented by implementing what we know today in terms of risk reduction. Tobacco misuse is a really important issue for all societies. Tobacco is the only product on the market, according to the World Health Organization, that kills 50% of its regular users. That's an amazing consumer product when you think about it. We think of tobacco misuse and lung cancer. It's much more than that. The nasty chemicals are in the bloodstream and they go wherever the blood goes. So your chance of leukemia is doubled if you're a smoker. Your chance of kidney cancer is 500% higher if you're a smoker. And so on and so on. It is very important to realize the consequences of tobacco misuse and where it has led us today. 20% of all cancers are caused by tobacco misuse. Unhealthy weights, otherwise known as obesity, account for probably another 15 to 20% of cancers. Hormones change when you gain too much weight. Growth hormones that make cancers grow faster are present. There are four major causes of cancer. I've named two: tobacco and obesity. What you eat, not just how much, is the third one. Try and eat real food and encourage it in your own communities. Food that comes from a factory may not be good for you. In fact, almost for sure, it's not good for you. It came from a factory. So the natural foods that you mentioned earlier, traditional foods, are excellent. And the fourth thing is a lack of exercise. Exercise can prevent bowel cancer. Exercise can prevent many cases of breast cancer. Those are proven in study after studies. How much exercise? Well, when I asked that question of an expert on that particular subject, the answer is more. More than you're doing now, that's for sure. So, as you are leaders and people in your communities listen to you, consider encouraging an active lifestyle, watching what you eat in calories and in content, and tobacco misuse is a big issue. This wellness concept leads to community health. Community health supports individual choices. So the correct choice, the healthy choice, becomes the easy choice in a supportive environment. Your leadership is important in making these changes. We at the BC Cancer Agency Prevention Programs fully support you in that. Count on us as your partners. Thank you.
Next up, to do the last part of the circle, I'd like to introduce the leaders of our 3 First Nations health governance organizations, the First Nations Health Council, the First Nations Health Directors Association, and the interim First Nations Health Authority, who will all say a few words and place this final piece of the circle. So,
the First Nations Health Council, would you please stand? There should be, and Charles, join us, because you served with us for most of the past 2 years. Would the members of the First Nations Health Council please stand? At the beginning of every one of our meetings, we begin with a roundtable. And we talk about where we're at with our own personal well-being. Sometimes we struggle with youth suicide in our communities, deaths of loved ones, our own children causing us challenges, grief and sorrow, sort of paying us back for our teen years. We talk about all of those things. We support one another. We trust one another. We love one another. And that's how we do our responsibility as leaders. It begins with understanding that each and every one of us has a gift, and we do our best to support each and every one of us practicing that gift. But we also need help because sometimes life is not too easy on us, so we support one another. Our team is always challenging us on increasing our activity level, on making sure that we are mindful, and so we continue to support one another as we report on our own personal wellness plans. We have a designated elder. He struggled with accepting that role. Wickaninish, please stand. He's our beloved elder. A couple meetings ago, he grabbed onto it and he said, "I'm okay with it. I can do this." And when we need the advice and support and direction from our dear elder, we have it. And I know that Quatsim does the same for our CEO and the senior management team and the staff and I know that he does the same for the board of directors. We believe that every important work, every important agreement, every significant accomplishment has to be celebrated with ceremony, to call upon the spirit of our ancestors, to make sure that the work that we do is grounded in who we are and where we come from. And so the work that we do is built on those teachings, and that we make sure that we carry them forward. Thank you.
Thank you very much, Grand Chief Kelly. I want to call you Doug. Can I do that? Okay. My name is Liz Whynot, and I am both honored and humbled to have been invited to join the brand new interim First Nations Health Authority Board, and I'm speaking just for a minute or two before lunch. Yes, I think lunch is planned, isn't it? Yeah. Just to talk about for a minute about our role in all of this. And, you know, we have a wonderful board, Pierre, Madeline, Jim, John, and Jason, myself. Lydia can't be here today. I am so honored to be with you in your presence, but I am also awed and a little bit overwhelmed by the nature of the challenge that is in front of this organization. Dr. Evan said that what we have here in front of us is he didn't use these exact words, but a unique opportunity to do something completely different and to address health issues from the perspective of strength, from wellness, and from fostering a different approach entirely. This is an amazing opportunity. And I think that I would speak for all of the board saying that we welcome the opportunity to work in partnership with you to figure out how that can be done best. As Doug's earlier timeline showed, there's been tremendous progress in the last 5 years. What is being done here is difficult, complex, and fantastically inspiring. So I want to congratulate everybody here and say that I welcome the opportunity in the next 2 years to work as a part of this interim health authority and try and make the next step a reality. Thank you.